Hello everybody, this is Gary. Today is Tuesday, September 24th. It is 10:55 a.m. Eastern Standard Time in the United States in Rochester, New York. And this is Gary, and this is my coping with schizophrenia vlog entry for today. Today I wanted to talk about electroshock therapy, also known as electroconvulsive therapy. Um, it has a bad reputation, especially because of the movie One Flew Over the Cuckoo's Nest, where they did electroshock therapy the way they used to do it. They would just hold the person down, grab their arms and legs, and put the electrodes on each side of the head, and then cause a seizure. And the person is awake during this process. No anesthesia was used in the original way they used electroshock therapy, so it would be an extremely painful and uncomfortable process, and it caused convulsions that could break bones, like the arms and legs, or make you uh, regurgitate stuff in your stomach that you could choke on. Um, Electroshock therapy is still done, but it's not done that way anymore. Um, Electroshock therapy is mainly reserved for depression that doesn't respond to any other treatment like antidepressants or antipsychotic drugs. And it's also true for schizophrenia and bipolar disorder. If the main symptoms are not relieved by medications or other forms of treatment, electroshock therapy or electroconvulsive therapy, that's the proper name, when it's used, they use anesthesia so you're not conscious when they're putting the electrodes on each side. Um, and they could do the electrodes either way. They could do both sides or only one side, where the electricity goes through the head. In other words, they can put the electrode on one side or both sides. Um, if it's only one side, then it's unilateral treatment. If it's both sides, then it's bilateral treatment. Um, but I have had electroconvulsive therapy done plenty of times, started in the early '90s, around 1993. Um, they anesthetize you. They give you muscle relaxants so your body doesn't go into convulsions. You're on oxygen during the treatment, and there's basically no convulsions in the body at all. So there's no breaking bones. There's no holding the patient down, and this is a very effective treatment for depression, mania, and schizophrenic symptoms that don't respond to medications. Like if a person is in extreme danger of committing suicide, shock therapy or electroconvulsive therapy might be used to be sort of like a last resort treatment for problems in psychosis, depression, mania, that kind of thing. I've had it done. It's perfectly safe. Um, Very few people have any complications from it beyond a temporary mental loss. I'm sorry, memory loss. Um, some people who have had electroconvulsive therapy claim that they have long term, permanent memory loss. Like they forget a whole year of their life. They forget what they did. They forget where they were. Um, I personally have not experienced that. I've certainly experienced temporary memory loss when I wake up, but that only usually lasts for a few hours. So I can't really speak to the idea, right or wrongly, if some people have long term memory loss. But again, they put the electrodes on the temples, the right and left. They turn on the electricity for a few seconds. It causes a seizure in the brain without causing the body to go in convulsions because of the muscle relaxants. There's no pain or discomfort involved because they use anesthesia, and it only takes a few seconds or maybe a few minutes to complete a treatment. One of the things you can't do if you have electroconvulsive therapy done is eat anything after midnight because there's the danger if there's food in your stomach, or even water for that matter. It could come up during the treatment and you could choke on it. So they uh, don't allow you to drink anything, including water or eat anything after midnight on the morning of the treatment, which would be the early next morning. But like I said, electroconvulsive therapy is not done the way they used it in the movie The One Flew Over the Cuckoo's Nest. Um, at least not anymore, and they haven't done it that way for a long time, where the person's awake and they go into convulsions and break bones and that kind of thing. So electroconvulsive therapy is still around. I've used it. I had used it about 4 months ago. I had to be in the hospital for 3 weeks to do it, um, but it was something that was necessary to relieve my psychotic symptoms and depression. Comment, like, subscribe, and share.